Well, there are so many ways to lead a healthy lifestyle, right? You eat right, exercise, get regular checkups. But those checkups should include more than just a visit to your family physician. So next week, there is an event that offers comprehensive advice for healthy living, especially as we age. So I'm joined today by Dr. Wesley Harnish from Eye Surgical and Medical Care, along with author Jan Rodenfels, a featured speaker at this event. So thank you both for being with me.
Thank you.
Nice to see you.
Okay, so Dr. Harnish, we're going to start with you because you're partnering with another company, the Family and Cosmetic Dentistry, as part of this big event, Healthy Living as You Age. So talk about the importance of doing this and why you wanted to be involved.
Well, we're working on all of the issues that affect aging and vision, including cataracts, glaucoma, and macular degeneration, which are the three big diseases. And we're wanting to get the word out there about the things that can be done these days to help in these issues.
And obviously your passion, eye health, that's what you're an expert in. So tell us some of the issues that we need to focus on. How can we take better care of our eyes so maybe those things don't happen to us?
Well, perhaps years ago there weren't so many things that we could do for an eye, but as we age now, macular degeneration is certainly treatable in the advanced stages, but we're able to slow it down significantly with eye vitamins these days.
Okay.
Cataract, we have great new things in cataract. We're doing cataracts earlier and earlier because removing a cataract with laser assist now can help to reduce the dependence on glasses, and many of our patients really get along without their glasses the vast majority of the time. Glaucoma's got new treatments for it, and glaucoma has always been a disease which gave fear to people, and we now have more new treatments, and they're very effective.
And you have strong opinions about reading glasses that are readily available without a prescription, right? People should probably take advantage of that.
Well, there's nothing wrong with wearing a drugstore reading glass, but custom-made reading glasses really offer a great deal more.
Plus, they look so good on Jan, right?
You can have the styles you want, and you can have glasses that actually are in very good focus at the distance you want rather than just an approximation of what you need. We've also got glasses available these days that do both arm's length for the computer and up close for reading, so we can do both of those things at once.
Okay.
So custom-made reading glasses can really offer a lot more to a patient than just a cheap pair of drugstore readers.
Right, exactly. And yeah, they all looked great on you, so I don't know what pair you'd pick there. I do want to mention real quick the actual event, Healthy Living as You Age, is Tuesday. So you can RSVP. We'll put the email address up on your screen. It is 10:30 to 11:30. And Jan, you are going to be one of the featured speakers, the author of an amazing book. It's called Amazing in the Second Half. So first of all, talk about the message in your book and what you're really trying to get out there for people.
My message is that, you know, we don't mind aging, but we don't want to feel old. We don't want to look old. And there's so many things that we can do in terms of nutrition, moving our bodies, and our spiritual life. That makes us amazing in the second half. And we live in a culture that doesn't value age. We worship youth, and we need to change that. And we can do that if we take really good care of ourselves. And that includes eating healthy. So eating healthy as we age encompasses a lot of things. We need to eat more fruits and vegetables. We hear that all the time. But how do we really do it? What I communicate with people is to make it fun, make it an adventure, and adding more fruits, vegetables, getting rid of the sugar, getting rid of the processed foods, and as much meat as we eat. We are really nutritionally deficient in the United States. In fact, worse than some third world countries. So we need to add in more leafy greens. And for our eye health, that's really, really important. We need vitamins A, B, C, D, and E. We need minerals. We need antioxidants like lutein and zeaxanthin. Like avocados, this has more lutein than any fruit. And lutein is really good for the eyes. And it also is full of vitamin E, which is good for our eyes. So this is a wonderful thing to replace instead of mayonnaise. Use avocado.
Use avocado. It's
Yes.
a great topping. And I want to say your book, that's part of, if you RSVP, right, you are giving your book away.
Yes.
To the first
20 people
20
to
people
register.
to register.
Yes.
Okay, perfect. Again, you guys, it is up on screen. Healthy Living as You Age, RSVP there, the event coming up on Tuesday, the 20th of August. Well, that would be the 27th, right? Did I say the 20th has already passed?
The 30th.
The 30th. Okay. I'm glad you corrected me there. Okay, it is August 30th coming up. So thank you guys so much for being with me.
Thank
Thank
you
you.
for having us.